If you're on Social Security or disability benefits, listen up. I have breaking news. I have your April 2025 Social Security payment schedule, and I'm going to give you the dates on when your payments are going to hit your bank account. And I have breaking news regarding Social Security rule changes. The Social Security Administration have made changes to their rules that is going to affect how you are going to interact with the agency regarding your benefits, and they have not sent out a letter yet. So these rules have not been communicated by mail, but they are taking effect on April the 14th. So you need to be aware of how this is going to impact your interaction with the agency. And I'm going to bring you all the details that you need to know to prepare for this April 14th critical date for Social Security and disability benefits. And watch till the end of this video, because I'm going to help you. If you're turning 65 or you're already on Medicare, I'm going to show you how to reduce your costs and save $1,100 a year with a program that I am excited to talk to you about. So, I am Kwame Kwade, and I am an entrepreneur and personal finance expert. For 15 years, I've been helping seniors get the benefits they deserve. We originally started with websites on Social Security, food stamps, Medicare, and Medicaid, and now we've added video and we're growing. And I am also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the United States. So if you're new here, hit the like button, hit the subscribe button, because all we do here is bring you the latest news and update, anything in and out of Congress that is going to affect your benefits. And then, as always, I want to know where you're watching this video from. So go into the comments and let me know your city and your state. Let's get started. Let's dive in. So what are these Social Security checks and when are they coming in? Well, the maximum check reached $5,108 in January 2025. It goes to those people who have paid the maximum into the system and waited until age 70 to get their benefits. If you are retiring this year at your full retirement age and you pay the maximum into Social Security, you are going to get $4,018. If you are retiring early at 62 and you've paid the maximum into the system, you are going to get 2,710. And the average benefit for everybody, if you take the average Social Security benefit as of November 2024, it was $1,925. There are changes that are coming. The biggest one is that the full retirement age is going to change again this year. It's going to go to 66 and 10 months. And then next year, 2026, is going to set at permanently at 67. So, what about the payment dates? You may already know this, you may not, but your payment dates are based on your birth date. So, if your birthday falls between the 1st and the 10th of the month, you get a benefits on the second Wednesday of the month. If your birthday falls between the 11th and the 20th, your Social Security and SSDI benefits are paid on the third Wednesday. And if your birthday falls between the 21st and the 31st, your benefits are paid on the fourth Wednesday of the month. If you're on SSI benefits, your benefits are paid on the first of the month unless the first is a weekend or a holiday. And then there are a whole category of people who are paid Social Security benefits on the third of the month. If you live outside the United States, if your state pays for your Medicare premium, if you're getting both Social Security and SSI, and if you apply for Social Security benefits before 1997. So here are the real dates. If you're on Social Security or SSDI, which is Social Security Disability Insurance, your payments are going to be hitting your account on the following schedule. If your birthday is between the 1st and the 10th, you're going to get paid on April the 9th. If your birthday is between the 11th and the 20th, you are going to get paid on April the 16th. And if your birthday is between the 21st and the end of the month, you are going to get your Social Security or SSDI benefits on the 23rd of the month. Now, today is April 1st. If you're on SSI benefits, you should have received your payment today. And on Thursday, April the 3rd, the following category of people are going to get their benefits on time, which is if you live outside the United States, if you receive both SSI and Social Security, if your state pays for your Medicare premium, and if you file for Social Security before 1997. Now, there's a lot of people who have been reporting that they don't get their benefits because of all the changes that are happening. Some benefits are being stopped. You may not know this, but the Social Security Administration is now clawing back 100% if you have an overpayment. So if you don't get your benefits, It may be because you are in an overpayment situation and they're holding your Social Security or SSDI benefits in order to pay back all the money you owe before they will resume your Social Security benefits. So if you want to find out what's happening with your benefits, call the Social Security Administration at 1-800-772-1213 and make an appointment to go see them in person, because it's the fastest way you can get help, because wait times on the phone are going to 3 hours in some cases with people trying to get services over the phone. Now, let's talk about these new rules. This is breaking news. I know a lot of you have been saying in the comments, I didn't receive anything in the mail. Social Security will not make a change without telling us in the mail. That is incorrect. That is exactly what they're doing. They've made a big change in how the organization runs and how you interact with them regarding your benefits. And they haven't even sent the letters out yet, but they go into effect on April the 14th. This is part of the DOGE efforts to tighten things up and eliminate fraud and waste and abuse. And they are changing the way you deal with the agency regarding your critical services. So let's get into it. So, what is this change about? Well, major changes and policy changes are coming. These changes are critical for all beneficiaries to understand, ensuring they don't face unexpected disruptions. The new in-person identity verification was supposed to start on March the 31st, yesterday, is being pushed to April the 14th. They've extended that deadline. The delay offers additional time for seniors and other affected individuals to prepare for the new requirements and understand how they might be impacted. So, who is exempt? Well, if you're on Medicare, disability, or SSI applicants, you are exempt from the in person verification if you cannot complete the process online. These exemptions aim to protect vulnerable populations who may face significant barriers to in person verification. These changes aim to reduce fraud, but also create challenges for seniors and vulnerable populations. Understanding the impact these changes are going to have is crucial to ensure you continue to receive the benefits you are entitled to without interruption. Now, what are these changes that are happening? Well, the first one is the in person verification rule. Retirement and survivor benefit applicants must verify their identity in person if unable to do so online. This requirement aims to reduce fraudulent claims, but could place a burden on those without internet access or those who have difficulty traveling. And then there's the overpayment issue that I was talking about. Starting March 27, that has already started, and they didn't send out any notice. Social Security Administration will withhold 100% of benefits to recover overpayment for new cases. This only applies to new cases. The policy change significantly increases the financial impact on beneficiaries who have received overpayments requiring immediate and full repayment. And then you've heard about the COLA, which happened earlier this year. Your cost of living adjustment went up by 2.5%, increasing the average Social Security benefits by 49% and disability benefits by $29 and $34 for SSI and SSDI, respectively. And then the biggest change they're making is cutting staff and closing offices. SSA is cutting thousands of jobs and closing field offices, impacting customer service availability and reliability. As a result, beneficiaries may experience longer wait times when seeking assistance with benefits, and it further complicates the process. So, who is going to be affected? Well, I want you to pay attention to this list very carefully, because there's been a lot of confusion around who the new rules apply to. The first one is retirement applicants. Those applying for retirement or auxiliary benefits must verify their identity in person if online options fail. The new rule adds a layer of complexity, especially for those unfamiliar with online processes or who lack reliable internet. Then there are overpaid beneficiaries. Anyone receiving an overpayment after March the 27th will face full benefit withholding until repayment is complete. This abrupt change from the previous 10% withholding can create significant financial strain, particularly for those relying on Social Security for their essential needs. And then there's SSI, low income seniors. SSI recipients undergoing redetermination. It means that you're going to get a lot of redetermination scrutiny when your time is up, these audits could lead to benefit adjustment or terminations if income or asset criteria are not met, affecting vulnerable individuals. And then finally, those without online access, seniors without access to SSA's online system may face longer wait times or travel burdens. Lack of internet access will force those seniors to rely on in-person services, which are becoming less accessible due to office closures and staff reductions. Now, who is not affected? That's also another important category of people. Number one is exempt groups. If you're on Medicare, you're on SSI or SSDI applicant, you're exempt from the in-person ID verification. And this was done to ease the process for individuals already undergoing complex application processes. And then there are current overpayment situation. If you're already on overpayment payment plan, you are exempt. So those already repaying overpayments at the 10% rate will not be affected by the new overpayment policy. This provides some stability for beneficiaries who have already established a repayment plan under the previous guidelines. And then there's further exemptions that may be announced for elderly surviving spouses. This is something that looking into to make survivor benefit application easier. SSA is considering expanding the exemptions to further minimize disruptions for vulnerable populations during difficult times, especially when you are going through survivor benefits application and mourning your loved one. They don't want to put more red tape in front of you. And then the people who do not have to do anything, this is a very important group. Beneficiaries already receiving payments do not need to visit SSA office or provide additional verification. This ensures that the majority of current beneficiaries are not inconvenienced by the new in-person verification requirements. Now, when current beneficiaries must visit SSA offices, there are situations where if you're already receiving Social Security or disability benefits, there are situations where you are required to go to the Social Security office, and I want to walk you through that. There are two specific cases. Number one, starting April 14, 2025, current beneficiaries who cannot use the online Social Security system to change their direct deposit information must visit the office in person. It means that if you are currently receiving Social Security or disability benefits, you want to change your direct deposit information, you are not able to verify your identity online successfully, then you have to go to the office and do that. And then, if for whatever reason you are required to verify your identity when you log in online and you cannot do so, then you have to go to the office. And then I mentioned groups that are exempted from this. And if you need to go to the office, you need to make an appointment. You can't just walk in. They require an appointment. And now that they're closing a lot of offices, you have to stay on top of this because being on the phone to schedule an appointment may take a while. And when you get to the appointment, what appointment you can get may take a while to even be booked to come to the office. And then when you get to the office, there may be a lot of people there, and you have to be patient because they are cutting staff and closing Social Security offices. So, what do you have to do if you have to go to the Social Security office in person, or you want to avoid going there? If you want to avoid having to go in person, here's what you have to do before April the 14th. The first one is set up an online account at ssa.gov/my account to access and manage your benefits digitally, reducing the need for in-person visits. So that's one thing you can do. Also verify your identity online right now. Use login.gov or id.me to verify your identity online, ensuring continuous access to Social Security online services without visiting an office. And then update your information. Go on Social Security, log in and update your information so that they have your current information. So ensure your phone number and email address are current on your Social Security account online to receive important notification. And then you can also opt in for online notices so that they're not sending you something in the mail that requires you to come to the office. Now, what action do you have to take before April the 15th? One, create an online account. Two, update your direct deposit information if you haven't done so already and have a need to do that. And then if you need something that requires an in-person visit, schedule your appointment now, because after April the 14th, there's going to be a huge backlog because everybody's going to realize who has been waiting on a notice at home. They haven't sent you a notice, but then the new rule goes into effect, and now you have to call and schedule an appointment and realize that it's taking a while to get through. And if you finally get through, getting an appointment date puts you even further behind. So it's important to do that now. In any case, if you experience something with the Social Security Administration where you feel like you've been treated unfairly, you can call your elected representative, your senator, your congressperson. They can also help you manage that situation with the Social Security Administration. At least they can send a letter on your behalf and get the Social Security to respond to them and get to the bottom of what's happening with your situation. Now, as I mentioned, overpayment is a big issue. They're making a big change. It used to be 10%, and then it was changed to 100%, and that is going to affect, or has already gone into effect on March the 27th. So if you are working while on Social Security before your full retirement age, or you're on disability benefits and working, those are the two groups that end up in overpayment situations. Make sure that you're following all the rules, because if you get paid more than you deserve or you're eligible for, and it catches up to you later, they're going to stop sending you your Social Security or disability check, and they're going to use that money to pay for everything you owe them until you're paid off, and then they'll resume sending you your benefits. Now, this is supposed to save the government $7 billion over the next decade, but it's a drop in the bucket. But they're going to do it anyway. But you have rights. You can appeal, you can ask for a waiver, but the problem is that they rarely grant appeals and waivers. And so just make sure you don't get yourself in an overpayment situation. If you are getting benefits before your full retirement age and you're working, pay attention to the earnings test. And if you are getting disability benefits and working, pay attention to the substantial gainful activity limits that affects how much you can make and still be considered disabled. Another change that is coming for disability beneficiaries is that you're going to get a lot of redetermination scrutiny. This is coming from DOGE. Regular audits to ensure SSI recipients still meet eligibility requirements based on income and resources. These audits are a standard part of SSI program to confirm beneficiaries continue to qualify based on their financial situation. Redeterminations are routine but may feel more stringent due to increased scrutiny under new policies. Increased scrutiny is being implemented as part of a broader effort to combat fraud and ensure program integrity. Failure to meet updated requirements could lead to benefit reductions or terminations, affecting vulnerable individuals who rely on Social Security, SSI for essential support. Now, to avoid disruptions, recipients should maintain accurate records and promptly report any changes in their income or resources to the Social Security Administration. Now, stay informed. Make sure you're on top of what's happening. Beneficiaries should update their SSA with income changes to avoid overpayment or disqualification. Regular communication with the Social Security Administration ensures accurate benefit calculation and minimizes the risk of overpayment or loss of benefits. So, what are the key takeaways today? One, changes are happening April 14th. You probably didn't get anything in the mail. That is true, but they're doing it anyway. So know when you have to go to the office to take care of specific needs. Monitor payments closely. If your Social Security or disability payments stopped coming in all of a sudden from here on, it may be because you owe overpayment and they've stopped sending you your payment in order to pay back the money you owe. And then if you need to contact the Social Security Administration, make a phone call, schedule an appointment, an in-person appointment to get any services that you need taken care of that require you to go to the office. And I've explained what category of people are required to visit the office to take care of specific needs. Now, let's talk about Medicare. If you've dealt with Medicare or you're about to apply, it is a nightmare for a lot of people. And if you've heard the stories of people who are trying to figure out the 24,000 different Medicare plans that are out there, what fits your need, what fits your budget, it is a nightmare. And over 1 million people have been dropped from various plans for various reasons. And it complicates things for seniors. We see news every single day of people being dropped. Here's one from Oregon where 25% of plans are leaving the program. And then here's Minnesota where, 5 health systems with Minnesota operations say they will go out of network next year with setting Medicare Advantage plan insurance. So there's a lot of changes happening. Why should you care? Well, 34 million seniors in Medicare Advantage plans face rude awakening. And because of this pressure, 90% of seniors are in the wrong Medicare plan. And it's costing you money because on average, a couple spends $300,000 a year on Medicare, in their retirement for Medicare expenses. And then it's costing you your health also, because if you are being dropped from plans and you're not aware of it, or you're in the wrong plan and your doctor network is not in there, or the medication that you are trying to get or need is not in there, it could create a situation where the help you need and the care you need, you're not receiving that. Well, there is help. Chapter Medicare is our partner. And actually, one of the founders of Chapter Medicare got into this because of how his parents experience with Medicare was such a nightmare that he wanted to fix this problem for all seniors. So they are a free, unbiased advisor, and they have access to all 24,000 plans. They are the only Medicare Advantage advisor with access to all 24,000 plans, and their agents do not work for commission. So they are there to help you find the best plan that fits your needs, your budget, and the care that you need. And this is the best part. They can save you $1,100 on average per year. So call the number on the screen, 539-205-2147, or go into the comments and you see a link that helps you sign up. You can fill out the form in the description. They'll reach out to you and help you, whether you're turning 65 and need to sign up for Medicare, or you're on Medicare and you're looking to get into a better plan. Call Chapter today. They are the real deal, and they're going to be able to help you. So that is all I have today. If you are new here, hit the like button, hit the subscribe button, and I thank you for watching this video, and I look forward to seeing you in the next video.